Well, the Health Minister, Nadine Dorries, joins me now. Good morning to you. After everything doctors and nurses have done for us over the last year, the sacrifices they've made, is a 1% pay increase enough?
Well, of course, we recognise the sacrifice and the commitment and vocation of nurses and all health workers over the past year. We've all been touched by or personally experienced by help from NHS workers. But I think it's important to note that the priority of the government has been about protecting people's livelihoods, about continuing the furlough scheme, about fighting the pandemic. And we've put huge effort into that. And we did not want nurses to go unrecognised or doctors, and no other public sector employee is receiving a pay rise. There has been a pay freeze. But the 1% offer is the most we think we can afford, which we have put forward to the pay review body. That will be discussed. We will wait for feedback from unions and other health sector stakeholders and see where we move to on this. But the 1% is what the government can afford. It's what the offer is. And, you know, it would be wrong to say that a single person in the government does not appreciate the effort of nurses. We absolutely do.
But you've been a nurse yourself. I mean, what we're talking about here is an extra £3.50 take home for experienced nurses a week. That isn't enough. What they're saying to us is it seems like an insult.
Well, as John's report said before I came on, nurses have had a 12% increase in pay over the last 3 years. The average nurse's salary is around, quite rightly, £34,000 per annum. But I'm afraid at this moment in time, at the tail end of a pandemic, you know, this time last year, we were just looking in the face of this global pandemic. And we all know what the last year has held and what we've had to go through. And that has been a huge amount of expense on fighting the pandemic and keeping to our best possible way, as a result of the efforts of NHS staff, people safe. Keeping people safe was our priority. Now protecting livelihoods and people's futures, jobs, businesses, making sure people can stay in employment, extending the furlough scheme. Those have to be our priorities now. It has to be about protecting people and livelihoods now that we've saved lives.
So hand on heart, can you look at NHS workers in the face and say, you know, you are not our priority at this moment in time? Because that seems to be what you're saying.
No, because that's not true. As I said, no other public sector employee is receiving any pay rise. There has been a pay freeze. The NHS workers are going to receive a pay rise. But as I said, there are still changes going, as your report said, there are still pay uplifts coming through from the Agenda for Change. Nurses have received a 12% pay rise over the last year, and quite rightly so. And their salary is now an average of £34,000 a year. We wanted to acknowledge
you personally,
nurses.
as a health minister, and previously you were a nurse, would you like to see them get more than 1% in an ideal world? Is that what you would like to see?
Everybody in an ideal world would love to see nurses paid far more in an ideal world. But we are coming out of a pandemic where we have seen huge borrowing and costs to the government. You know, only a year ago this week, when we had really no idea what was coming at us. And, you know, we've come through this as a country with the huge efforts from both nurses and doctors and all healthcare workers. We have come through, we're coming out the end of this pandemic now, and the priority has to be about saving people's jobs, which is why the furlough scheme has been extended until the autumn.
Is this something that would have been imposed by the Treasury? Would there have been disagreements between the Treasury and the Department of Health?
That's way above my pay scale. I have no idea of any disagreements or any discussions. I know what we can afford, though. I know what we've spent. We all know what we've spent. And everyone knows the efforts that the Chancellor has put in to make sure and to ensure this government protects people's jobs all the way through this pandemic and continuing now until the future, until we know we're well and truly out of the other side.
The galling thing for many in the NHS is that in real terms, this is actually a pay cut if inflation is predicted to rise, as has been suggested.
Well, even John Ashworth said in your report, if the predictions come true, we don't know what the future holds. We know that at the moment, you know, we spent 10 years following a Labour government fixing the economy. What we need to do now is to make sure we keep fixing the hole in that roof to keep us stable enough and the economy stable moving forward. And the only way we can keep the economy stable is to protect people's jobs so that they have jobs to go back to protect businesses so they're there to offer employment in the future. And that's where our priority has to be. You know, it's like anyone in any home, you have a priority on your purse. And our priority is about keeping people in work and protecting people's jobs. That's the choice we've had to make moving forward. And, you know, as I said again, no other public sector employee is receiving any pay offer over the next year. This is a recommendation from the government, which has gone to the public at the pay review board. That has gone forward as a recommendation. There was an offer made there has been an offer made to the pay review board. We hope that will be accepted because it's what the government can afford.
If the pay review board comes back and says actually that this is derisory and enforces that on the government that they actually have to increase the pay offered to NHS staff, is that something you would welcome? Well,
they are discussions for the future, and they're discussions that Matt Hancock, the Secretary of State, and the Treasury and others will have. As I say, at this moment in time, our priority is protecting jobs. It's about extending the furlough, and it's about ensuring that we made an offer to the NHS, because the huge effort. There are not words to express how grateful everyone has been to nurses.
They don't feel that those in the NHS don't feel as if that the government is grateful by any stretch of the imagination. We all remember the clap for the NHS, going out and seeing shots of Rishi Sunak and Boris Johnson clapping hands for the NHS. This morning, they're saying that it doesn't feel as though their efforts have been welcomed and have been received, and certainly not reflected in this 1% pay increase that's being proposed.
Well, I hope nurses recognise that it's this government which has given them the 12% increase over the past 3 years in their pay, and that we have acknowledged their effort and their contribution by making a recommendation to the pay review body this time. As I said, quite rightly, the average nurse pay is now at £34,000 per annum. That's happened under this government, and we're proud of that. And quite rightly, nurses, we owe so much to them. But at this moment in time, having faced the year that we have with this pandemic, I think some have described,
But can you understand, though, why? Sorry to interrupt, but I just want to get to the crux of this, really. Can you understand why they are so disappointed this morning?
Yes, of course I can understand. Anyone can understand. But I want every nurse and every doctor to know we are hugely grateful to you, but that the government has to set priorities, and our priorities have had to be saving people's jobs, extending the furlough, offering business grants so that businesses can keep running, about keeping people in employment, so that, without a good economy, without those businesses, without people in employment, we need that money to continue funding our NHS, our world-class NHS. And so that had to be the government's priority.
You've obviously explained the government's importance, that they hold the NHS in high regard. But the Institute of Fiscal Studies, they've criticised the budget for having implausibly low spending plans, including, excuse me, a £30 billion reduction in healthcare budgets next year. Now, I'm wondering why you would think that public spending should be lower than it was a year ago, pre-COVID.
Well, that's absolutely not true. And I think that was disabused yesterday. That 30 billion, I believe, was a reduction on the pandemic spending. It's not, there are actually real-time increases going into the NHS budget year on year. That figure, I'm afraid, is completely wrong. That's not on our annual funding of the NHS. That was on our pandemic budget, which is completely separate.
But correct me if I'm wrong on these figures, £3 billion has been allocated to bringing waiting lists down in 2021 to 22. That's one of the areas that you've injected cash into. But £1.3 billion has been spent by hospitals on adapting to the virus. So when you put them side by side, you can see the shortfall.
There are absolutely no cuts moving forward to frontline NHS services, either in waiting lists, accident and emergency. There's just no cuts moving forward. There are real-time increases going into the NHS budget. So I'm afraid that isn't right. There are no cuts to NHS budgets moving forward. We have obviously allocated huge amounts of money to dealing with the pandemic, which was required. Obviously, as we get on top of the pandemic, as the vaccine rollout continues, then we're not going to need as much money to fight the virus in the way that we have done over the past year. And there where I believe you will see the reductions, but in terms of the real-time NHS budget, there are no reductions.